everyone. Welcome to Spotlight on Douglas County. We have Dr. Lindquist in with us today from Monarch Medical Center to talk to us. The holidays are coming up and we all like to eat all that delicious, wonderful food. So kind of how to manage your weight a little bit. How are you?
I'm good.
Good. Thanks for being with us. So first of all, tell us what you do and what Monarch Medical Center is all about.
Well, what I do is to help take care of patients and people who want to find ways to manage their weight. There's a huge epidemic of overweight and obesity, not only in the United States, but in the world. And I've managed to have a good time helping people do that, and I've learned a lot along the way. We take an approach to it. We say that overweight and obesity is a medical condition that's amenable to medical treatment, and that is a chronic condition and needs to be treated on an ongoing basis. People need to have strategies and tools to use over an extended period of time. That's what we do.
Okay, great. Now, with the holidays coming up, I know we all like to gorge ourselves in a bunch of good food and everything. How bad really is that for you? Is it?
Well, that's a great question. It's not so much what you do really at any one time over the holidays. It's what you do on a consistent basis that torpedoes you. And it's really hard to eat one meal and get so many calories that you gain a huge amount of weight.
Okay.
But overeating on a consistent basis over time, which is really what the majority of the problem with overweight is, that type of pattern is ultimately what does you in.
Okay. Now, over time meaning what? Weeks, months, years? What is?
Days into weeks into months. You know, time passes quickly. People wind up going on vacation for a week or so. That's not bad. Then they get back to work and maybe they eat the snacks that are sitting on the counter because everybody likes to bake and we love food.
Right.
And, you know, over a period of time, over a couple weeks, 3 weeks, people find, wow, I've put on an extra 5 or 10 pounds. And that's a typical scenario over the holidays.
Okay, now weight gain. I know a lot of people sometimes say it's genetic and it's also lifestyle. What part really is, I mean, do you think it's more genetic or do you think it's more of a lifestyle?
The tendency is genetic.
Okay.
And the opportunity to gain that weight is environmental, as part of our lifestyle. If you believe that we used to run around eating whatever we could get as human beings, we didn't have a lot of food. Food was hard to come by, and so we'd browse, we'd eat small amounts of food, and it was hard to put on weight. Then if we had opportunity to have a big feast, we'd store naturally what we had that was excess. And that's the way that we're designed, I really feel. Well, these days we don't have any lack of food. There's food on every corner. You could overeat 30 times in a half-mile radius of where we are right now. So it's the predisposition to gain weight is genetic. The opportunity to do it is part of our environmental and our societal situation today.
Okay. Now, what can people do? What are some preventative ways that people can help maintain that weight better?
Well, we have a system that's based around a handful of key concepts. Number one is that you have to manage your calories. You have to know what's going into your mouth, and we can't just free eat whatever we want and assume that we're going to put a limit on how many calories we get. So having some idea of what actually goes into your mouth, whether that's counting calories. In our program, we use a lot of what are called meal replacements, where there's a set number of calories in the medical food product. So managing your calories, and typically to lose weight, restricting your calories. Then we use frequent small meals. Those calories spread out over 6 to 7 times a day.
Right.
So you're always telling your body, I've got plenty of calories, I don't have to starve, it's okay to go ahead and burn some fat.
Now, what if that's not possible for someone? I mean, I know for my career, I'm so busy all the time, sometimes I don't have time to stop to eat little meals. What do you suggest people do?
Well, I think it's something that can be worked into a lifestyle.
Okay.
We happen to use a lot of bars and shakes. There are other types of food sources that are pretty convenient. It doesn't take long to put water into a pre-mixed shake and shake it up, and you can do it within less than 2 or 3 minutes. So it is possible to get calories. It does take planning, and that is hard. And it is, if you have to cook, it can be a challenge to do it. So I think the big thing is make wise food choices as often as you can.
Okay, thank you so much for being here. If you want to find out more information, you can call 673-2774. Thanks for being with us.